not the expert on rural communities, and in fact, I want to just shout out to the folks who are here from the Franklin Council of Governments, Regional Council of Governments, who really know backwards and forwards what's going on in Franklin County. I'm the Director of Community Action. We're the community action agency for both Franklin and Hampshire counties, so the two northern neighbors of Hampden County. And Hampshire County has this dubious distinction of being lumped with Franklin County for some services and lumped with Hampden County for other services, and for some things, nobody's really paying that much attention. So for regional transportation, Hampshire County is with PVTA. For community action, it's with Franklin County. For employment and training with Franklin County. For regional planning with Hampden County. That's similar in a way to some other parts of our region that all, and I'm not going to say, by any means going to say that Hampshire County is suffering from that. Poor people in Hampshire County are suffering from that, but not everybody in Hampshire County is suffering from that. But it's not dissimilar to what's going on in the North Quabbin, where some people go one direction for one set of services and another direction for another set of services, or the town of Ware, which is a Hampshire County town, but receives services in other places, and it's very difficult to get to services. Transportation is key to that. But I didn't really come here to talk about transportation, Frank. I hope that's okay.
That's fine.
Because we're not a transportation agency, we're an anti-poverty agency, and we're kind of a 50-year-old agency put together by President Johnson as a part of the war on poverty, and as an aside, never declare the end of anything or declare war on anything, because forever people will say, well, it never ended or you didn't win the war, okay? But what came out of that war on poverty are programs that we know support our communities in very fundamental ways and have kind of been baked into the lives of people living with low incomes. WIC, the modern food stamp program, Head Start, the modern sort of iteration of how child care has been distributed, all that's even changing. Even our baseline health investments in elders and poor people grew out of the war on poverty. Am I right about that? I think I am. So, and then all these community-based agencies that we now know, CDCs and so on, some of those were started by community action agencies and then spun off onto their own. And the theory behind community action was that you have public sector, private sector, and representatives of community sitting around together at a table trying to devise solutions for your community. And what's happened is that the bureaucracy has made that harder and harder to do. So what we now do is count outputs. Do you all know what I mean by that? How many people you saw? How many programs did you do? We don't really think about what was the result of that. It's because the people who give us the money want the head count. And that works against change. I also want to say that at the time that we started investing in low-income communities, there was some hope and some belief, and belief grounded in reality, that government could actually change the condition of people's lives. Now we live in a country where people have less and less faith, especially in the federal government's ability to get anything done or to make changes in people's lives. That's really tragic, because we know it has made a difference in people's lives. But the real activity now in terms of making change in communities is happening at the state and local level. And so that's why this meeting is so important, because this is where it's happening, right in communities. I want to talk about an intervention that we've known for 50 years now that works for families and works for children. Head Start, funded by the federal government. Children go to Head Start, they come out, and then the buzz from the right wing is that it doesn't work, and by third grade, the results of Head Start have been are not visible anymore. Nobody ever says that maybe the school was the problem, except the people at Head Start. And nobody thinks about the non-cognitive benefits of going to Head Start, the self-regulation skills that children receive from being in quality early childhood settings, the ability to work collaboratively with other people. There's a whole set of those, and if you're interested in that, James Heckman, who is a guy who was a Federal Reserve guy who now does extensive work in early childhood education, has a whole website talking about that, and I know PolicyLink has looked at some of those things too. But I want to talk about one result coming out of a Head Start type program in North Carolina that looked at children who had been involved in full day, full year programming with health supports, that meaning that they helped children, make sure children had a doctor, helped to make sure that children had dentists, that their immunizations were up to date, and that there was a lot of physical activity and good food in the setting that they were in. They followed those people 30 years later, and the people that were in that study, forget about what they did in terms of education, that's not what we're talking about right now, their health was better. Because of that short intervention, relatively short intervention in their preschool years, their health was markedly better. They're connected to a doctor as an adult, and if they took the control group and looked at it, and they were markedly worse. And they also looked at a group of children who had the same intervention, but it was in elementary school, and they didn't do much better than the control group. So where the action is in early childhood. And it's there for two reasons. One is that's when children are developing these critical self-regulation skills, and some of those determinants of health come from those self-regulation skills. And secondly, it's the time when parents really can help, you can really help parents develop those skills in order to help keep their children on track through their childhood. We've been disinvesting in that. Everybody's talking about early childhood education, but we're disinvesting in it. This year, in the governor's race in Massachusetts, they're talking about early education. Ask them what they really mean. Does it mean full day, full year programs for children whose parents are working? Or does it mean a half a day here with a kid getting on a bus and going somewhere else and then going somewhere else? That's not good for kids. And it's really not good for families. Does it mean that, yeah, your kid has care, but if you lose your job, your kid loses care? You know, if you're in the 3rd grade, you don't get thrown out if your mother loses her job. So let's really have a serious conversation about what we really mean when we talk about investing in young children. We talk a lot about things being for the children. How many people hear that? Oh, this is for the children. I used to be an elected official. I'm in recovery now, and we're going pretty well. But I'll tell you, anybody who came to meet with us to tell us that something had to happen, they would say, it's for the children. And I'd say, yeah, it's all for the children. But what are we really doing for the children? What are we really doing to make sure their lives are stable? So I'm talking about early education and how that can be a stabilizing influence in young children's lives, and how if we have classrooms where the same teacher is there for the whole year, and the reason they can be there for the whole year is because they get paid enough to pay their own rent, and they don't have to go to Target to get a job, which is competitive, and waste the education they had in early childhood. If we have those stable classrooms, kids do better. Kids do better, and you know what? Their families do better. So that's my plea on early education as a way to transform lives. I want to come back for a minute to the rural challenges for that. We transport children across lots of territory to get them to quality early education environments. We use family child care extensively in the rural areas because having a group of young children in a provider's home, a high-quality provider's home, works well too. But that costs money. Either of those cost money, right? Transportation for us is not going down in the corner and jumping on the T to get your kid to care before you go to work. So we have to be thinking about that too. And I just want to make one more pitch. We can put all of those supports in place for a family, all of those things. But if they don't have a house that they can afford, a home they can afford, their school setting gets blown up, their early care and education setting gets blown up, their doctor relationship, that the child's pediatrician relationship often gets blown up. So we have to look at the housing piece as complementary. That's a whole nother discussion. But I think the numbers are so dramatic, and we've known it for so long about early education. Can we finally step up and actually make the investment?